Hi guys, my name is Gabriel. I'm going to be your instructor for today. And today we are doing conscious oral care. Now in conscious oral care, there's a lot of steps and a lot of random order that you have to remember, but it's not too crazy hard. And if you need to, you can rewatch this video over and over to make sure that you get it. All right. Now for conscious oral care, we're going to need 2 cups. In one of my cups, I'm going to have water. In one of my cups, I'm going to have a water mouthwash solution. That's going to be 1 part mouthwash, 3 parts water. Of course, I have my mouthwash. All right. I need an emesis basin, toothpaste, a toothbrush, floss, non-petroleum lip balm, and a hand towel. All right. Now, since we're dealing with okay, now that we've gone over all of our supplies, let's get started. So what we're going to do first, of course, we're going to not going to introduce ourselves. I'm going to tell you, my name is Gabriel. I'm going to be your CNA today. I'm just coming in to get your mouth cleaned up. We're going to brush your teeth this morning. Is that okay? Fantastic. I'm going to wash my hands. I put on gloves. Right? I want to provide privacy. And then I'm going to sit my patient all the way up to 90 degrees. Perfect. All right, now that we're set up to 90 degrees, remember that because this is conscious oral care, that means that my patient can assist me. So I'm going to take my hand towel, I'm going to sit over the top of my patient just to keep their clothing and their bedding from getting dirty. I'm going to give them their emesis basin so they can spit as needed. First thing I'm going to do is I'm going to give them a sip of water. Sip of water, swish, and spit. Next, I'm going to take my toothbrush, toothpaste, and we're going to brush. Now when we brush, we go outside first, then inside, and then tongue. So, outside, then inside, and then tongue. I let her spit and have water as necessary, or PRN. After that, I give her a sip of mouthwash, swish and spit, and then I pull my floss. Now when I pull my floss, I pull 16 to 18 inches of floss. Right, at that point, I start flossing. I floss between 1 tooth, between the second tooth, and then I move to a new spot. Between 1 tooth, between the second tooth, and then I move to a new spot. And I do that all the way around the mouth. From there, I give a sip of water, swish and spit, and then a sip of mouthwash, swish and spit. I take this emesis basin and clean it per facility policy. I take my towel and I pat my patient's mouth dry. This towel goes into my dirty hamper. And then I take my non-petroleum lip balm and I put non-petroleum lip balm on their lips. Now, we say non-petroleum, that's specifically if my patient is on oxygen, but more often than not, where you're going to be, they're going to have non-petroleum lip balm or some sort of non-petroleum lubricant product. Right? At that point, I'm going to sit my patient back down to a comfortable position. That's at 30 degrees. About 30 degrees there. I give them their call light. I clean up my area. I make sure that they have water at the bedside. I ask, all right, Ms. Helen, is there anything else I can do for you? No? All right. I take off my gloves. I wash my hands. I record and report.